Good afternoon, denture peeps. I had one of my comments asking me to talk about horseshoe dentures. So let's beat a dead horseshoe. So, this is something that when I talk about this, I always get hate. I get people coming for me in the comments. But let's talk about it. Like, why do you all think that dental providers do not want to take out the palate of an upper denture? Why do you think that that is the consensus? Why do you think it's such a big controversy? I know that I've made many videos and replied to many comments about don't do a horseshoe denture on the top. You will not be happy with it. And I get all the comments that argue with me and tell me. Yesterday I had one on the other platform and it said that I'm not very sharp, lady, because I was saying, why you shouldn't get a horseshoe denture, what a horseshoe denture really is. And yeah, it's really a controversial topic. So let's talk about it. So when you go to a dentist or a denturist or a prosthodontist, when you ask for them to make your upper denture a horseshoe denture, they're not going to want to do that. And why? Okay, because when you get rid of the palate of an upper denture, you lose suction. And here's where everybody's going to come for me in my comments. They're going to say, my denture is horseshoed and I have suction. I don't wear adhesive. Well, 100% I believe that that is absolutely inaccurate, that these patients who want to come for me in the comments and say that they have a horseshoe denture don't really have a horseshoe denture. They have a denture where the palate has been significantly reduced, but it is not a horseshoe denture. An upper horseshoe denture actually looks like a lower denture. You see how there's no middle to that? If you were to take this entire palate out, then it would be a horseshoe denture. And I think that people want to fight about it because they're just misinformed about what a horseshoe denture really is. Now, let's just say, why do we not want to do that? Why would I not want to just give the patient what they want and take their money and send them on their way with a horseshoe denture? Well, because I know that if I make the denture a horseshoe denture, then they're going to have to wear adhesive to keep that denture in, because it is physics. You cannot cut a suction cup into the shape of a U and try to get suction with it. It's not going to happen. So if I take out this palate for a denture and expect the patient to get by with that, I know that they're going to have to load this up with adhesive in order to keep that denture in their mouth. Now, that's the other controversial thing that I talk to with patients on here and my own patients all the time. I do not want to see patients loading up gobs of adhesive in their dentures because it will potentially be problematic down the road, okay? You'll love it now, maybe, if you like adhesive in your mouth, but if you have to put gobs of adhesive in your denture, then your denture is always going to be moving around a little bit against the bones, and it's going to erode that bone off. So why would I not just, send the patient out with a horseshoe denture and be like, okay, thanks for your money, here's your horseshoe denture? Well, because I have a conscience, I don't want to give the patient a product that I know they're going to have to use gobs of adhesive to hold in their mouth, and they're going to wear their bones down. And then, a few years down the road when they break this, because if it's shaped like this on the upper, it's going to eventually break. But if I do that, then they're going to come back to me years, however long down the road, and then they're going to have no bone in their mouth, and then they're going to want me to make dentures for them, and I'm going to have hardly anything to work with because they're going to have flattened their bone down with their denture rubbing and rubbing and rubbing against that bone. So not only is it unethical of me to just take somebody's money and give them what they want, a horseshoe denture, but it makes my job or the other provider that they go to down the road makes their job harder down the road. I don't want patients to chew their bones off wearing gobs of adhesive and, eroding their bone by their denture rubbing against their bone. I don't want to do that. My practice would probably make a heck of a lot more money if I just made products for people based upon what they dictate to me and just tell them, yeah, Dentures, they are just, they're just loose. They just have to be glued in with a bunch of adhesive and a bunch of product. And that's just the way it is, You can't expect a denture to fit properly. You just got to wear a bunch of Fix-A-Dent or Polygrip or Cushion Grip or Dentach or all of these things. Just get by with all of those. And yeah, my patients, when they would come back in and say, hey, my denture's really loose. Oh, well, you know what? There's nothing I can do about that. You get what you get. Just put a bunch of product in it and glue it in your mouth. That sounds like, I'd just be making money and seeing patients and just skipping on down the road. But you know what that would result in? First of all, it would kill my conscience. But second of all, it would kill my practice because people would not be satisfied with the products that they're getting out of my practice. And when they talk to another denture patient who went to another practice whose provider cared about how their dentures fit and didn't send them out with ill-fitting dentures where the bite was off or it was too loose or it was horseshoed and they had to glue it in, and these kind of providers, like, these patients are going to tell my patients, hey, your provider, she's gaslighting you. She is telling you that you have to wear adhesive with your dentures, and a lot of times that isn't the case, and your bite isn't coming together properly, and she sent you out of there and just told you that's how it is. She is a bad provider. So, my practice wouldn't last. I wouldn't be successful like I am. I would not get the great reviews that I get, and I would not have the kind of reputation, the good reputation that I have in my community. So, I try to explain to you guys why, and sometimes I get some really hateful, mean comments about it. Believe it or not, when I first came onto this platform and started giving denture education, I had a lot of denture wearers on here. I mean, really come after me hatefully. So hatefully that it was later shared with me that there was a couple of them that were talking and, planning to try to get my business shut down. My actual business, not my TikTok page, my actual business, just because they didn't like what I had to say about wearing adhesive and relying on those kinds of products instead of getting well-fitting dentures. I mean, I had some serious hate on here. So I guess just the moral of the story is, you might want to delve a little bit deeper into finding out why providers don't want to horseshoe your denture. Why, when you go to any dental practice, and if you're a dental professional, chime in here in the comments. Let's do a poll. As a dental professional, do you think that horseshoeing an upper denture is a great idea for your patients? Is that something that you would think is successful? Keeping in mind, a horseshoe is not trimming it to here. A horseshoe is taking out the entire palate. It is actually, look it up. Anyways, the definition of it. So I hope my content helps you. I feel like sometimes I'm just a mom of a teenager, when your parent tells you shouldn't be out there driving drunk, or you shouldn't be out there, engaging in risky behavior, and you think your parent's a jerk and you just think they don't understand and what's the big deal. Like, sometimes I feel like that when I'm giving out, advice to denture patients. Like, sometimes I'm telling you this stuff because I've been doing this for decades and I care. And I want you to have a good future for denture wearing. I want you to have a good experience with denture wearing. So I'm telling you what's in your best interest. Okay, have a good day.